This is not medical advice. What this is healthcare consumer advice, so that as a healthcare consumer, you will know the best uses of your money and your time, two of your most precious resources. So this is not medical advice, but I'm going to talk a little bit about the medical community and weight loss.
This content has been inspired by the Afrocentric Woman, Love Wisdom, Fierce ESG Diva, A Lifestyle by Danielle, and My World.
As a healthcare consumer, you should know that you have two options when it comes to seeking medical assisted weight loss. You have a surgical option and a pharmaceutical option. And then there are pseudo medical or paramedical options. I'm going to go over those three options for you because this is consumer advice, not medical advice. So you can decide as a healthcare consumer where you would like to spend your time, money, and resources.
There are currently 2 obesity surgeries that are approved by the FDA that are available for weight loss. One is endoscopic sleeve gastroplasty. The second is vertical sleeve gastrectomy. Vertical sleeve gastrectomy is the most popular procedure for patients who have a BMI of 35 to 40% in addition to a comorbidity. This surgery is usually $25,000 and up, depending on what part of the country you're in, where about 70% of the stomach surface area is removed, restricting the amount of calories that the patient can intake. Now, because African American women tend to be healthier at heavier weights, sometimes vertical sleeve gastrectomy won't always be covered by their insurance. In comes endoscopic sleeve gastroplasty. Endoscopic sleeve gastroplasty is a procedure in which a fiber optic scope or an endoscopic scope is put down the patient's esophagus, and the size of the stomach is reduced by suturing the inside of the stomach to a smaller size. You get a reduction of 50 to 60% of your stomach volume. Typically, with endoscopic sleeve gastroplasty, there's a shorter recovery time than with VSG, vertical sleeve gastrectomy, but still equal effective rates. And because it's a more affordable and is not covered by insurance, it's half the cost. Also, endoscopic sleeve gastroplasty, some people may think it's a quote unquote new procedure, but if you have an experienced bariatric or gastrointestinal surgeon performing this procedure, this is not their first rodeo with this equipment. Endoscopic sleeve gastroplasty was usually used for patients who've had stomach cancers, who had bleeding ulcers, any kind of intestinal torsions or necrotic bowel syndrome. So basically, it's a newer use for already existing technology. So it tends to be just as safe as vertical sleeve gastrectomy, depending on who's performing it. If you're eligible for ESG or VSG, that's really up to your surgeon and your insurance company. So it's worth getting that first, second, and third opinion if you are considering surgical weight loss. Remember, this is not medical advice. This is consumer advice. If you are considering a surgical weight loss option, it is worth it to consult physicians about both ESG and VSG. Find out your insurance eligibility and also financing options, because this is not medical advice. This is consumer advice. If you are one of those women who know that you need to lose 100 pounds, you've lost 40, and now you fall below the BMI ratio for VSG, you may want to get that first, second, and third opinion if you are eligible for ESG, and what kind of follow-up procedures they're going to offer as far as nutritional and mental health support. Also, if you are eligible for VSG, you may want to talk about the symptoms, side effects, and the follow-up and lead up to procedures to your surgery, because it is an invasive procedure. Ladies, this is not medical advice, but rather consumer advice so that you're making the best decision for you. The medical community also offers pharmaceutical weight loss options that fall into about 3 classes of drugs. One being orlistats. These are drugs like Ally, Xenical, that stop you from absorbing all of the fat that you ingest in your food. This usually can give you about a 15% reduction in BMI if you're compliant with the medication regime, but be very aware that it can hinder the absorption of some fat-soluble vitamins, so make sure that you're working with your doctor and nutritionist if you're going to get on a regimen of Ally. The second is phentermine. This has been a long-approved appetite suppressant that is proven to be effective to give you about a 10% reduction in BMI. It does have mild stimulant properties, so make sure that you are eligible to use this type of medication and get screened for things like high blood pressure, which could be a contraindication. The third class of drugs kind of falls in like the psychotropic category, right? Would be things like Contrave, right? This is a mix of an antidepressant and an anti-addictive drug. If you are working with a mental health professional and you feel as if your weight gain or the fact that you can't lose weight is attributed to your depressive disorder, this class of drugs might be right for you. Simply because those suffering from clinical depression are more likely to have brains that can be overly stimulated by addictive substances. And since things like refined sugar can be metabolized by our bodies and brains really similar to the way our bodies and brains metabolize cocaine, drugs like Contrave can be really helpful for patients who are under the supervision of a mental health care professional and their depressive disorder is affecting their weight. So these 3 classes of drugs definitely can help you with your weight loss goals, but make sure you consult your physician and mental health care professional to find out if they're right for you. Now remember, this is not medical advice. It's just advice to you as a healthcare consumer. Next would be the paramedical or pseudo-medical procedures that can help with weight loss and fat removal. These are things like smart lipo, Zerona lasers, invasive surgeries like liposuction, or semi-invasive surgeries like the Obera gastric balloon. These are typically procedures that are performed under medical supervision, but not by like a bariatric or gastrointestinal surgeon, usually, or a board-certified plastic surgeon in some cases. These are procedures that are typically done by medical professionals who have an additional certification in these said procedures. So you're under medical supervision, but you usually are taken care of by skilled or certified or licensed technicians under a physician's supervision. So these procedures usually are for people who have a BMI that is over their ideal weight, but don't cross the obesity threshold, and only can be responsible for about a 10% BMI reduction. But these procedures are still worth looking into if you feel as if they offer a degree of effectiveness and safety that is consistent with your goals as a healthcare consumer. This is not medical advice, but just rather things that might be helpful to know as a healthcare consumer if you feel that your weight loss could be supplemented or could be augmented by the help of a medical professional. These are questions that you should ask, procedures you should inquire about to make sure that they're safe and that you have a rapport of trust with the practitioners involved. So as you go forward in your health and wellness journey, nothing is going to replace eating well and exercising with a procedure or not. But know that if you do need some assistance, the medical community is there should you ask the right questions to the right professionals, and don't be afraid to get a second or third opinion. This is Mocha Mommy, and I'll see you in the next video.